My name is Massimo Caputo. I'm a British Heart Foundation professor of cardiac surgery. I'm mainly working with infants, neonates, children and young adults requiring cardiac surgery. My work is based here in the Starship Children's Hospital and in the Bristol Children's Hospital. This research project is called Understanding and Improving the Surgical Outcomes of Children Undergoing Aortic Valve Replacement due to Rheumatic Heart Disease. Our project aiming at improving the understanding of why these young adults' valves are affected by the rheumatic fever. And the second goal of this project is to see whether new surgical techniques can help improving the results of replacing some of these valves in this young population. The research is very, very important, especially in New Zealand. When I arrived, I discovered a huge number of young adults with rheumatic heart disease, especially in the Maori and Pacific population. There is an incredible discrepancy in this condition in this specific population. So the current valves that we use in young adults are not very good. The options are either you use what we call a mechanical valve, but this requires a tablet every day, which makes the blood thinner, and lots of young adults don't like that because they want to have an active life doing lots of sports. The other option is to use tissue valves, which are mainly from animals or from humans. But again, these valves, they don't last very long. So we want to evaluate procedures that are using the patient's own tissue to create the valves. One procedure is called the Osaki procedure by the surgeon who invented this procedure. Is using the sac that surrounds the heart and create the new leaflets for the aortic valve. And the second procedure is the Ross operation, which is using the patient's own pulmonary valve and reimplanting into the aortic position. In my experience, having done research in the last 30 years in cardiac surgery, having founders like your kids to provide this initial budget for creating the data that we need is fundamental for any development in a long-term project. My main message to founders and the people support Cure Kids is that without their money, we won't be able to make any advance in research. Having the support of charities like Cure Kids is really fundamental.